morning and welcome to the COVID-19 talk with the local health authorities. I am Stephen Williams, Director of the Houston Health Department. With me, we have Dr. David Persse representing the City of Houston and Dr. Umair Shah representing Harris County. This is sponsored by the Rotary Club of Houston, and my thanks goes out to President Kathy Finninger, who always provides me with a stack of questions to ask these health authorities. Just going to jump right into it. As physicians and healthcare professionals, but also as citizens of Texas, economy, healthcare on balance, what are your honest thoughts re the state's continuing drive to reopen, even in face of rising case counts and hospital ICU utilization rates?
Want to start?
Concerned, worried. If you want us to be honest, I mean, from a public health standpoint, politics aside and all the other things aside, all the other consider from a public health standpoint, it concerns us. We're really worried about the fact that we're reopening. Doesn't feel like there's been any way to slow down any of that reopening. And you can reopen, but reopen with health and safety in mind. And we are seeing now some businesses, unfortunately, that have reopened and they've seen cases and they've had to shut back down. And that was really our concern.
Yeah, I would say that the conundrum that I'm facing with this is that we recognize the economy's got to get up and going. And this is going to be a marathon, right? Yeah. So we have to get to the new normal. We've been saying this again and again and again. But the new normal involves wearing masks, social distancing, not having large gatherings. And that's the friction. So the businesses that need to reopen and get reopened, they've also got to, they have to have their employees wear masks, get their patrons to wear masks, social distancing. You got to do that, or else you're going to wind up in a situation you just described where businesses opened, then 50% of their employees got sick and they had to shut down again. That was foreseeable. We basically told you that was going to happen.
Right. And then customers don't want to go to your business.
That's right.
Right. So there you have two restaurants or two whatevers, and you can make a decision. And if you turn out and you see that there's a reputation of a certain establishment following health protocols, another one not, who am I going to go to with my family? I'm going to go to the one that's following the health protocols.
That's right.
So yesterday, it's my understanding that the judge actually, the mayor, not the mayor, the governor gave local authorities the flexibility to implement mandatory masks, to give businesses the authority to require masks for their employees and patrons.
Yeah. So it appears the governor was not going to object to Bexar County, San Antonio's decision to require masks for those going into businesses, right, to patrons or customers in a business. So that has opened up the question of how does this impact other counties across the entire state. So I think that's just to clarify, Stephen, that was what occurred.
My problem with what happened yesterday is that I think that it's going to leave the problem with this whole thing moving forward, in my opinion, is then it became politicized. And so what happened yesterday, if not managed properly, we will wind up in that same situation. So quite honestly, the business owners themselves have got to step up and start having rules for their employees and having rules for their patrons to keep their places of business safe. Because if they don't do that, then you're going to paint the judges and the mayors into a corner where they're going to have to do that. And if that happens, then people are going to start saying, oh, you're stepping on my rights, and it gets politicized again. The virus is not political. The virus doesn't care. The virus is going to spread if you give it an opportunity. You give it an opportunity, it's going to spread. So just don't give it the opportunity.
Yeah, that's right. And we've seen, and we've talked about this, that inconsistent messaging, Stephen, from federal level, state level, local level, if there's inconsistency across the board at that individual community member level, they're like, well, look, if they don't have their messages together, if they're not on the same page, I'm just going to chance it. I'm going to risk it. I'm not going to wear the mask, or I'm going to just go out in a large gathering. And that, you have us here because we're health authorities, and we're about public health. We're about protecting, and our jobs as physicians, we've done this for years, is to help people understand what their risk is and to try to help prevent disease. And that's really the perspective we're coming from. And that's been challenging because, as David said, politics has gotten into the mix.
Okay, medications and vaccine. Researchers in England have found dexamethasone reduced deaths by a third in severely ill hospitalized patients. World Health Organization advised against using steroids. Please translate Persse, you made a comment about that in the
Yeah.
press conference yesterday.
So weeks ago, it was felt that steroids ran the risk of making the situation worse, and so they were pretty much advised against, and a lot of places stopped using them. And that was based on experience where steroids appear to make patients get worse. So then this study came out. Now remember, this is one study, and we've been here before, where one study came out and everybody followed it before it was peer-reviewed and critically reviewed. And so it's one study. Now the World Health Organization had been against steroids, but in light of this, they came out and they actually are supportive of the use of dexamethasone. But I would just caution everyone, it's based on one study, and let's not make the same mistake. So let's, the clinicians are going to make up their own minds as to whether or not they're going to follow this, but it's going to be interesting to see.
It is, it is exciting. I mean, if this is, what dexamethasone is Decadron, which we use in the hospital setting all the time. We even use in outpatient settings. It's really a steroid for anti-inflammatory, essentially, for rheumatoid arthritis and all sorts of other things. And we've even used it for even more serious conditions in the ED, for example, if somebody's having, inflammation in the brain after a stroke, things of that nature. And this is a really important potential finding.
Yeah.
But it's early.
FDA appears to have pulled the emergency approval of hydroxychloroquine. This seems to change weekly. What's the latest? They pulled it.
Well, there it is.
Yeah. Again, there was another one study situation.
That's right.
In poor countries around the world, vaccination drives have been canceled to reduce virus spread. What is Houston doing to encourage vaccinations?
So we've been talking with we have the Vaccine for Children network of our providers, and it's not like we need to educate them. They're well educated on it, so we have to get back to educating the public to feel comfortable going to the pediatrician, because a lot of parents are afraid that if they go, then in the waiting room, they're going to get caught. So hospitals and doctors' offices have done a great job of making their workplaces, hospitals and doctors' offices have made a great job of, they're safe to go to now, right? So you should feel comfortable. Call ahead, give your appointment, show up on time, get your child vaccinated.
Yeah, our physician colleagues, I was just going to add, is including our own family doc for our family, have frantically been trying to get people into the clinic to really catch up on vaccines, and we know it's important. So if your pediatrician or your doc hasn't contacted you, contact them.
Thank you for tuning in to our COVID-19 talk with local health authorities. We'll be right back in a few minutes.
Wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
To Together, we can help slow the spread.
Welcome back to our COVID-19 talk with local health authorities. Please teach us how to breathe, just about a new book that says the majority of Americans breathe inadequately, especially when wearing a mask. You need to consciously breathe more slowly. Inhale through the nose and exhale through the mouth to make sure you're getting enough oxygen. Is this important, or have you heard about this before?
I have not heard about this, but I will say that we do know a lot of people, a lot of Americans have breathing issues, especially a lot of sinus issues, and the blockages of those sinuses leads to sleep apnea at night. And there's also been that, that piece. So we do know that facial coverings can make it a little bit more difficult, just because you've got something that's restricting your ability to get breath out and breath in, but not to the point that I've seen something to advise people on how to breathe through a mask.
Yeah. I'm far less understanding than you are, because I've worn all different kinds of masks, and I have no difficulty breathing in any of them at all. I have sometimes difficulty being heard because it muffles my voice, but I have no difficulty breathing through any of them. Now, I do worry about people who are disabled in some form, that if they had a problem with their mask, they wouldn't be able to remove it. But just a normal person up walking around and got sinus problems, and I know lots of people with sinus problems who tell me they have no problems wearing masks. So you'd have to have one heck of a sinus problem to not be able to wear a mask. So I'm a little bit less understanding.
No, I didn't mean to say that you can't wear the mask. I can understand why somebody would say it, but not. If they came to me and said this is the reason, I'm not sure I would agree with it, but I could see why somebody would think
I have heard of the breathing technique. Actually, when I was running, one of my colleagues who had been in the military was telling me to use that technique when I'm running.
Breathe in through your nose, out through your mouth?
Yeah.
Yeah, when I was in high school track, they taught us that.
Yeah.
I went faster that time.
All right. We'll wait the guidance from TEA to plan for a return to school, and I've heard a rumor that they will not mandate masks. Does that sound safe?
I think that's going to be problematic. I mean, it's the same thing. Large numbers of people in small spaces for prolonged periods of time, that's how the virus spreads. So depending on what they do with the classroom, I mean, if they want to greatly depopulate the classroom somehow, then maybe. I can also see it's going to be really difficult to get. I'm thinking maybe your grade school students might be compliant. High school students, there's going to be that section that are independent thinkers, and they're going to say no, and it's going to be an issue. But nevertheless, if you want to spread the virus, you take a lot of people, you put them in a small space, and you keep them there for hours on end.
And not have a facial covering.
And not have facial coverage, right.
So Bob texted us and has a comment. He references former mayoral candidate Bill King and says that he made some reference to our per capita death rates. He said they're relatively low because of excellent prevention steps. Is that too early? Virus not yet spread yet? What are your thoughts about that comment?
Well, David and I were on a call just about an hour ago with our other health authorities across the region, and we were having this discussion. And I do think that we should be very thankful to our community for everything that it's done, that everything that we together have done in order to fight this virus, and the death rates thus far have actually been markedly better than many other large urban counties. But let me stop right there and just add the second piece of it. This virus has taught us, do not be arrogant, do not have hubris, do not think that you've got it worked out, figured out, because the next corner can be something that's a detour and lurking behind that corner. And so, it's what I would say is continue to keep it up, but it's too early to let our guard down.
The death rate is a very late indicator of how things are going in the community.
Yeah.
We're still, just yesterday we reported 7 more deaths, but one of them was from April. Yeah. So the death rate's a very late indicator.
Okay, I thumbed through this, and we have a lot of practical questions that folks are asking. You've mentioned toilet issues before, but the topic keeps flashing around with advice to just lower the lids. Most public restrooms don't have lids to lower. Is this really a big deal? What should schools do?
Well, there was New York Times had a report about this, and we don't think it's a significant driver. We just don't know how much of a driver it is. I would say if you have a lid, keep it closed for other reasons, but not to be focused on that. Certainly if you have your mask on, et cetera, then that also prevents something that's happening in an aerosolization nearby in a restroom for it to get to you.
Yeah. I don't know if we've got any science behind the risk from a toilet. We do know that the virus is shed in feces. That's well accepted. You know, I don't worry so much about toilets as I worry about homeless encampments, where there are people sort of, you know, pooping by trees and stuff, as opposed to toilets.
I've heard the virus stays on surfaces longer in high humidity areas. Are we doomed in Houston? Don't worry about it, it's mine.
It's yours? Okay.
It's mine.
Well, if that's the case, you know, we have not seen it around the country, around the world, with the high humidity being a significant driver. If it were the case, then Houston would have an issue because we have a lot of humidity here. Last time I checked, but we don't see that to be necessarily true as it's played out around the world.
We've talked about heat and humidity inhibiting the virus, or hearing heat and humidity may facilitate the virus. So right now our numbers are going up. Our hospital admissions are going up. Right. So, and it's hot and humid out there.
That's right. And I think that's the key, Stephen, is that as you get to your next question, is that we are concerned about what we're seeing in our community with increased cases, increased hospitalizations, and even what's happening in the healthcare sector. And that's why we cannot rest on the laurels of the last 4 or 5 months. We have to continue to fight this pandemic.
Physics of Fluids says the mask will not provide complete protection without social distancing. Unmasked coughing can spread droplets 18 feet. Even masks are only good if worn properly. Is 6 feet apart enough?
In combination with masks, we believe it is. If you can be 20 feet apart or 50 feet apart or 100 feet apart or 1,000 feet apart, that's even better. But let's be practical.
Yeah, it's not a question of eliminating the risk, it's a question of managing the risk. And so 6 feet apart is a manageable distance where people can still interact and have conversations. If you wear a mask, is there still a risk? Yes, but it gets really small compared to being our usual sort of conversation distance without a mask.
For several restaurants and bars that are temporarily closed after positive cases were found, what is the protocol for when they can reopen?
Well, a lot of them, my experience, one of them that we've got that I know of that are closed because their workforce is sick. And so they will reopen when their workforce recovers and they can open up their establishment again. And hopefully they'll then have safeguards so the rest of their workforce doesn't get sick.
So that really gets back to the practicality of reopening and also not wearing masks and exercising good hygiene.
That's right.
Thank you for tuning in to our COVID Talk with local health authorities. We'll be right back in a few minutes.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
Doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome to our COVID-19 talk with local health authorities, sponsored by the Rotary Club of Houston. We've been told 14 days is the key, and now a study out of Singapore says patients are not infectious 11 days after getting sick. Is that true?
I haven't seen that one.
I haven't either, yeah.
So we don't really know about that one. CDC study says that those with underlying conditions are 12 times more likely to die, regardless of age. If I have no health conditions, should I continue to stay home?
Well, we want to still ask people, if you don't have to go out, don't go out. But those who are over 65 or with those underlying health conditions, absolutely minimize your amount out.
Yeah. And I also want to get people to start thinking about, and this is going to sound so terrible, but it's not just about you.
Right.
It's not about your risk of dying. It's not risk about how sick you're going to get. It's also your risk of spreading.
That's right.
So that's the one thing that people really got to get their head around.
That's right.
Some new symptoms from CDC are chills, muscle pain, headache, sore throat. What are COVID's distinguishing symptoms? It sounds like flu, allergies, or my son saying he doesn't want to go to school.
Well, loss of sort of the smell and the kind of the
taste.
Taste has been. They've actually, a couple of studies have shown that's significant. And especially an abrupt loss is really a higher rate of COVID-19 diagnosis. So I think that's where I would go, probably more so. Mm-hmm. But cough, fever, and respiratory remains the mainstay.
Yeah, and even the loss of taste and smell only afflicts about 20% of people who are diagnosed. So yeah, it's unique, but it's not universal.
That's right. And then there's also GI, right? Some some in the stools as well.
Is there a possibility that staying at home is negatively impacting our immune systems?
Well, if you stay at home and you're sedentary, that might be, because your immune system, the more active you are, and if you exercise at home and you interact with people, that be by Skype or whatever, and you maintain your emotional, that's your immune system actually is impacted by those things. If you just sit at home and watch TV and eat Cheetos, then yeah, your immune system may suffer as a result.
So being sedentary is not healthy?
Being sedentary is not healthy.
Including if you go to work and you're just on Zoom meetings or whatever, virtual meetings all day, and you don't get off your chair. So yeah, this is universal regardless of where you are. We want to make sure you're active, and it's not just about COVID, but also your physical and emotional health.
So you're giving me permission to not participate in Zoom meetings?
No, you need to do it while you're on a treadmill.
TWC will be requiring those on unemployment to start their job search as of July the 6th.
Okay.
I didn't know that. Okay.
I mean,
we just
moving towards the new normal.
Safely.
Yeah, we got to move towards the new normal.
Okay.
What country, if any, should we copy that's exhibiting best practice?
The one that I'll throw in, the one that I've been really most impressed by is New Zealand. Mm-hmm. It is obviously a different population demographic. It's an island, all those things. Been to New Zealand, people are fantastic. They have really done an amazing job with fighting this virus. There are a number of other countries that we're watching, but that's the one that I really like to point to. David?
Oh, I haven't been paying attention to the other countries. The city of Houston's big enough for me. So.
Tracking and testing. We're told to self-quarantine if we have symptoms. Widely available home testing is not available, but we're told it's important to get rapid treatment. What
there is no treatment.
We do? That's puzzling to me. Explain it.
Yeah, it's puzzling to me too. There really is no treatment for people who don't require hospitalization. And the other thing is that the testing, case investigation, and quarantine, and contact and quarantine. So quarantine is about not spreading the virus. So I don't know that I have answered the question at all.
No rapid treatment.
No, I mean, it's supportive treatment, right? Even outpatient. So it's if you need to take, if you have a fever, to take something to get your fever down and make sure you got fluids, don't get dehydrated, those kinds of things.
Okay. Which mobile data tracker do you recommend? My school is trying to figure out whether to participate. Some work on Apple only, some on Androids only, some change. What about privacy? How is the data consolidated? I know your health authorities, but...
Yeah, I don't feel qualified to answer. I mean, we look to our IT people to advise us. One of the big concerns, of course, is the privacy issue, and that's the area that I don't understand well enough to comment on.
This next question, I think, is related to privacy, and you might want to expand on this. In New York City, contact tracers are not permitted to ask if a person was at a protest. What is the rule in Houston? Shouldn't we know in order to understand more about transition?
We have not, David, you can talk about your contact tracer. We have not given any restrictive rules to for any questions. I mean, really, honestly, if outside of, you're not going to ask you your bank account information, social security, you know, the non. But from a health standpoint, if the question is where have you been, large gatherings, I don't care what the political reason is or the affiliation, left, right, red, blue. If you are in a gathering and our contact tracers discover that, we're going to ask more about that because we want to determine risk. And so this is not about politics. This is about health.
Yeah, agreed. We're the same.
Yeah. It appears the number of positive cases are increasing faster than testing. But we keep hearing the increases are because of more testing. Please explain.
Well, there's a little bit of a confounding variable there. Testing is going up. Now we seem to have plateaued. The percent does seem to be creeping up, but remember, we're also doing some targeting still of the testing to our higher risk environments, and so that may be pushing the percentage up. What we really need, what we've talked about getting, is a true prevalence study done.
How are restaurants being monitored to ensure they're following guidelines?
Well, you know, our environmental inspectors are still doing the kinds of things they do. You know, of course, it's been impacted by this work, but we are really relying a lot on those businesses themselves to do a lot on their own, because we can't. I mean, we talked about this earlier today. We have 25,000 food establishments within Harris County, including the city of Houston. That's a huge number. We have to rely on those businesses themselves, the business owners, the workers, and obviously the patrons. And then our health departments are doing what they can as well to do the inspections.
We have a 4.5-year-old child. Would it be okay later in July, August to take a vacation by car here in Texas for 1 week or two, specifically in the Austin area?
It's going to go to the specifics of your trip. Exactly. I like the idea of going by car. It depends on where you're going to go. Are you going to go to an urban place and go to fun parks and stuff? Probably not. You're going to go someplace a little bit more rural with family where there's a lot of space. That'd probably be great.
And I
Would
think
it be safer to stay in a hotel on a road trip or in a house?
In a house.
Yeah.
In a house?
Yeah.
What would be a safe place to travel in Mexico City or to a vacation spot on the Pacific coast of southern Mexico?
No, boy, we're going to, maybe the next show we can just do all about vacation spots. I think the key is that wherever you go to the destination, you need to know how you're going to get there, what's the best way in transit, and also when you arrive there, what's happening in that community.
Currently, a young child plays outside with other children. Is it safe to go swimming in their home?
So the thing about the swimming, and I'll take this one. The thing about swimming is the chlorine in the pools. You know, the water isn't the problem. It's when kids get in pools and they get all close to each other and they climb on each other and they play and then they aspirate a little water and then they start coughing, and that's where the virus spreads. It's all that coughing.
So it's not the water; it's the intermingling of the children.
That's right.
Thank you for attending our COVID-19 talk with local health authorities.
Father's Day.
It is, but
Happy
I got to close. Happy Father's Day.
And be physically distanced.
Thank you for attending our COVID-19 talk with local health authorities. Dr. David Persse, the city, Dr. Umair Shah with the county. Thank you, President Kathy Finninger, Rotary Club of Houston sponsored. I'm Stephen Williams, the Director of the Houston Health Department.
Thank you.